everyone. So, in this lecture I am going to discuss about the disorders of GIT. One by one we will discuss the disorders of the mouth, then we will cover the esophagus, then disorders of the intestine, small intestine, large intestine, then there are some disorders which are associated with the accessories organ of the digestive system. So, let us start with the diseases of mouth. So, here is the one condition, inflammatory and infectious condition. See, there are sometimes we will see the inflammation in the gums, we will see inflammation in the mouth. Yes, there are many reasons why it is going on. There are sometimes the infection is there, bacterial infection, viral infection, sometimes the food habit, yes, is responsible. So, the causes, the basic causes here like corrosive substances, there are sometimes abrasive substances there, excessively hot we are taking or cold substances we are taking as a food. So, they can cause the inflammation. Inflammation of mouth is known as stomatitis, yes. This term you need to know, stomatitis. And inflammation of the gums is known as gingivitis. So, here you can see inflammation in the gums, this region, yes, which is known as gingivitis, and here we can see the inflammation in the mouth, not only this particular area, but in the mouth anywhere there, if there is inflammation, we are saying it is a stomatitis. So, this inflammation we are seeing, yes. Now, what could be the other infections or other diseases of the mouth? So, there is a one condition, oral candidiasis, yes. I think with the name we are very clear, oral candidiasis means this is very specific with the mouth, oral, and candidiasis, that is a fungal infection. This is also known as thrush, yes. It is an acute fungal infection in the epithelium of the mouth, and it is caused by the yeast, the fungi, Candida albicans, yes, and that fungi means the yeast, it grows in the white patches. The white patches we can see on the tongue or the oral mucosa part. Here we can see, yes, this is the infected tongue. So, this is also one of the problem we are seeing in the mouth as a disease or part of the infection. Now, angular cheilitis, yes, what do you mean by angular cheilitis? So, the painful cracks which is developing in the folds of tissue in near to the corners of the mouth, yes, and the reason associated with it is a infection, yes, dryness, yes. So, infection, if I talk about the infection, so basic microorganisms which is involved here is the Candida albicans or Staphylococcus aureus, yes. Sometimes there is some nutritional deficiency which is causing this problem, angular cheilitis. So, deficiency of iron, deficiency of vitamin B, yes, that can also cause this particular condition. So, how we are treating, of course, will prefer for some vitamin supplement, vitamin B supplement or iron supplementation. So, you can see here these corner sides of the mouth, they are inflamed, yes, they are cracked, yes, and that is painful. Now, coming to some congenital disorders, there are many disorders which is going in the mouth or esophagus, small intestine, large intestine. We are covering here only those which are very you can say very much coming in the books or very much used in the literature, yes. So, congenital disorders, here we are talking for the diseases in the mouth. So, what type of congenital disorders we are seeing in the babies is the cleft lip or cleft palate, yes. So, cleft lip or cleft palate means there is the opening or there is a split, there is not a proper closure which need to be done, yes. So, there will be the opening or there will be the splits which we will see in the upper lip area or in the roof of the mouth. If there is a split in the upper lip, we call it as a cleft lip. Yes. If there is the opening in the roof of the mouth, which is called as a palate, yes, then we will call it as a cleft palate. Yes. So, cleft lip and cleft palate result when facial structures that should be developed in an unborn baby, they are not properly developed. They don't close completely. At the time we will see these conditions. Yes, we will see some of the pictures here. See, this is the cleft palate. So, in the cleft palate, what I told you, there is the opening in the this roof of the mouth. So, here we can see that the palatine bones are not present. Yes, that is a cleft palate. And in this situation, we can see the child is suffering from cleft palate and cleft lip and cleft palate both. Means the palatine bones are not present and lip closure. You can see there is a lip opening. Yes. So, there the two conditions are there. One is a cleft lip and cleft palate. In this example here, these two pictures we can see here is a unilateral cleft lip and bilateral cleft lip. Here we can see only one side is affected. Yes, the lip area, only one side is affected, one side is not properly closed. Here we can see this is a bilateral cleft lip, means there is an opening from both of the sides. Yes, both of the sides are not properly closed. So, this is also some of the problems we are seeing in the babies. Yes. So, that is a congenital disorder. Now, coming to the diseases of salivary glands. So, there is one condition called as a mump. Yes. Now, mump is a viral illness which is caused by paramyxovirus. This is a viral disease. Yes. What happens here is a inflammation in the salivary glands. Yes. And this paramyxovirus is a member of rubella virus family. So, here we can see, I told you the salivary glands are of three types. Yes, parotid gland, submandibular gland, and there is a one sublingual gland. So, one of the gland which is here is a parotid gland, they are swollen here. Yes. So, this is a very common feature in the mumps. There is a inflammation in this particular area. Now, what are the symptoms? So, symptoms are fever. Yes. Then loss of appetite. There will be headache, there will be muscle pain. When we will eat, there will be pain. Yes. Pain in the areas which are associated with this particular area. So, pain in the ear, then jaw, chin area. Yes, pain in other side as well. So, pain on both sides of the face. Cheeks will be swollen, jaw will be swollen. So, these type of some common symptoms will appear in the mumps. And how we can treat it? So, see, we can treat it, means we can prevent it. I am not talking about the treatment here, but yes, how we can prevent it by the vaccination. So, there is a MMR vaccination. Yes, measles, mumps, rubella vaccination that can be given to prevent this particular condition. Yes, the mump. Now, how it spreads? So, this is the viral infection. It is spread through the airborne, coughing and sneezing, or saliva, or through touching the contaminated surface. Yes. Now, coming to the disease of esophagus. So, there is a one condition, esophageal varices. Now, what happened in the esophageal varices? So, the veins present in the esophageal area, which is the varicose veins, they become dilated. Yes. And due to the dilation of these veins, they can ultimately lead to rupture when there some circumstances will appear. yes, there will be a pressure that will be generated in these varicose veins, they will be ruptured, there will be they will start to form bleeding. Yes. So, this condition will appear in esophageal varices, the swollen veins will be there, the inflamed veins will be there, they can rupture, they can cause bleeding as well. When it occurs, it is associated with alcoholism, a very very common problem or common complications we are seeing with the alcoholic patients is the esophageal varices. So, here you can see there is a dilation of the varicose veins, and there is a straining we can see in these of the veins which will ultimately ruptures, yes, and there will be bleeding. Now, the other disorders which are in the esophagus is eclasia. So, see eclasia, what do you mean by eclasia? This is a very rare disorder, and in this disorder it is very difficult to take food, yes. Take food or whatever the thing we are taking, means whatever the content we are taking, that is very difficult to pass further, yes. So, what happens here, why it is difficult to take the food or a liquid, why it is difficult to pass the food further? There is one problem. Eclasia occurs when the nerves in the esophagus become damaged. Yes, it is due to the damage in the nerves in the esophagus area. So, if we'll see, if you will see these two pictures, the normal esophagus, and there is a one patient with eclasia. So, there is a dilated and tortuous esophagus. We cannot see the contraction and relaxation which is required for the for passing the food. There is not proper peristaltic movement will be there, just because the nerves are damaged. Yes. So, there is a dilation, tortuous esophagus, the food cannot be passed, and narrow lower end of esophagus we can see. This is one of the problem we will find in some of the patients. So, what it will cause, at a result the esophagus become paralyzed. This section we can see, this is paralyzed and dilated over time, and eventually lost, further it will lose the ability to squeeze food, to cause contraction, to cause proper relaxation, to provide the force to move the food content forward or further in the stomach area, that will be lost here. I hope this is clear to all of you about the eclasia, the condition, this rare disorder. Now, there are some tumors of the esophagus. Yes, sometimes we will see tumors. Now, tumors are of two types. Not only the esophagus, tumors can be also with the mouth. It could be in other areas as well, small intestine, large intestine. Yes, tumors can be in any of the part. Now, tumors are of two types. One is the benign and another is the malignant. Benign is a local tumor, means it will be in one of the area where it is, yes. In the malignant tumor, it is one of the spreadable form of tumor, means it will locate from one part to the other part, yes. So, this is very serious condition, malignant tumor. Now, if we will see the data, so it will show particular to the stomach or the esophagus or the mouth, the malignant tumor are more in males and females, and this is due to some of the habits like smoking or alcoholism, lot of alcoholism is there, yes. So, this is why it is causing the more cancers in males. Now, they are more common in lower esophagus area, and both types of tumor, either benign or malignant, they tend to begin as an ulcer, yes. They will start as a ulcer and then they will further cause the problem as these tumors will form, yes. So, here we can see this is one of the tumor. Now, coming to some of the congenital abnormalities associated with esophagus, yes. So, there is a two condition we can see on the slides here. One is the esophageal atresia, yes. and the second is the tracheoesophageal fistula. Now what it means? So firstly we will see what is the basic difference between these two terms, and then we will see the diagram, what the diagram is showing. So esophageal atresia means the lumen is narrow or blocked. This esophagus is either narrow or it is blocked, and in the tracheoesophageal fistula means there is an opening. Fistula means opening. Yes, there is an opening which is connecting the tracho and esophageal. So whatever the content which is going from the esophagus, that will pass to the trachea. That is a very severe problem. Yes. Now if you will see the diagram here, this is the trachea. Yes, and further there will be the lungs. Yes. Now this is the normal thing we will see in all of the people. Yes. Now if you will see on the back side, there is a esophagus. This is a normal esophagus. Yes, both are separated, the trachea and esophagus both are separated. In this you can see the esophagus here, it is not connected with its second part. This is also the esophagus, this is also the esophagus, but it is not connected. So that is the esophagus atresia. The connection is lost. Yes, or the lumen is narrow or it is blocked. This is blocked. We cannot take anything. We cannot take food in this condition. Yes. Now this particular condition is the atresia, means the esophagus is blocked or esophagus is not joined properly. In the second scenario, if you will see from the lower side, this particular esophagus is joined with the trachea, and this condition is called as a tracheoesophageal fistula. The opening, there is the opening of this esophagus and trachea. So the content which is in the esophagus, that will come in the trachea region. Yes. So this is one of the problem, this is one of the congenital problem. In this picture, this is a very elaborated or enlarged picture we can see. There is a esophageal atresia, the esophagus is blocked and there is a fistula. This esophagus, the second portion of the esophagus is it is opened in the trachea region. Yes, I hope this is clear to all of you. Then coming to the diseases of stomach, the first one is the gastritis. Yes, gastritis means the inflammation of stomach. Yes. Now what are the reasons why there is an inflammation in the stomach? There are many reasons. We are taking the drug, we are taking some medicine. Yes, there are sometimes we are taking that type of food. Yes, junky food. There sometimes the infection is responsible, the bacterial infection, the viral infection is responsible. So there are many things which are associated with the inflammation in the stomach area, and that can be for a very shorter duration or a very sudden onset, that is the acute gastritis. The second thing is the chronic gastritis, which will long for many days. Yes, there could be the gastritis inflammation in the stomach due to one of the bacteria, Helicobacter. This is causing ulceration also. Yes, peptic ulcer is one of the condition which is caused by the Helicobacter also. So there is an inflammation in the stomach due to Helicobacter. There could be one of the reason autoimmune chronic gastritis. The autoimmune chronic gastritis means the immunity is our immunity, our cells, yes, which is for our defense, they are damaging the gastric layer. Yes, they are damaging the stomach wall, they are causing the inflammation in the stomach, and the reasons are unknown, but yes, we have seen some of the patients who are suffering from some of the autoimmune diseases like diabetes is there or some other autoimmune diseases there, then we have seen they are also suffering from the gastritis. Yes. Now coming to the other diseases like peptic ulceration. So it is caused by the disruption of the normal balance between, there are two factors. Yes, what are the factors? First is the corrosive effect of gastric juice. What is the corrosive effect of gastric juice? Means HCl, hydrochloric acid, and protective effect of mucus. So in our body, in the stomach, the mucus is formed, which is providing the protection against the gastric acid, and hydrochloric acid is also formed from the parietal cells. Yes. Now, if there is a imbalance between these two, so there is a very severe production of the HCl is going on, that can cause the peptic ulceration, or there is a we can say the mucus formation is not proper. At the time also the peptic ulceration will occur. And sometimes we are taking some types of medicines like non-steroidal anti-inflammatory drugs like aspirin, yes, like diclofenac. These type of drugs which are under the non-steroidal anti-inflammatory, they can also be associated with reducing the prostaglandins. They can also cause the peptic ulceration, yes. So, there is a one important point, the main protective mechanism are the good blood supply. This is the protective mechanism. If there is a good supply, there is a adequate mucus secretion, efficient epithelial cell replacement is there. Yes, the cells are forming, as they are getting damaged, the cells are forming in that particular way. Then the healing is also so fast. By this way we can say yes, the stomach area is affected. Now coming to the tumors of the stomach. In a similar way as we have covered the esophagus, there are two type of tumors here, one is a benign and another is a malignant. Okay. A benign is the which is located in a particular part, whereas the malignant tumors, they are spreadable. They are more common in man than women, the reason is same as I told you. Now coming to appendicitis. Yes, this is one of the problem in the intestine. Now, appendicitis means there is an inflammation in the appendix. So, see what is appendix? Appendix is a finger shaped pouch which is present at the lower right side of the abdomen. So, you can see this is a large intestine and there is a one finger shaped pouch which is called as appendix. Now, this appendix is inflamed. Here you can see in this diagram, this particular area is inflamed. Why? Because here we can see the calcified fecal deposits are there. Sometimes there is a bacterial infection that can also be associated with the inflammation in the appendix. Yes. And sometimes we are seeing the surgeries will be there with this appendix. Yes. Now coming to the typhoid fever. Yes, this is very common problem. We have seen number of cases in our surrounding with the typhoid fever. Yes. Now, typhoid fever is also known as enteritis. Yes. This enteritis is one of the condition which is causing the inflammation in the small intestine. Yes. It is caused by the bacterium Salmonella typhi and it is caused due to the contaminated food. It is caused due to the contaminated water. The incubation period for this particular typhoid fever is 14 days. Yes, means after the ingestion of the Salmonella typhi, how many days it will require to show the symptom? That is the 14 days. So, 14 days will be required to show the symptoms by a particular person who is the carrier of the Salmonella typhi. Now, during the incubation period, the microbes, they will invade the lymphoid tissue. The lymphoid tissue which is present in the small or large intestine. Specifically, they will invade the areas of aggravated lymph follicles and which is called here as a pair patches and solitary lymph nodes which are smaller lymph nodes. Yes. So, they will invade that particular area and that will also cause the inflammation in the liver, inflammation in the spleen or inflammation on the other areas. Now, in the bacteremic period and at that particular period means the bacteria are present in the blood. Yes. When the bacteria will present in the blood, they will cause acute inflammation, yes, and then they can cause the necrosis in the intestinal area. That why we are saying one term, enteritis. Now see, I already told you, when there is a inflammation in the intestine, the inflammation can reach to the spleen as well. Yes, so there is one diagnostic test through which we can identify, yes, the spleen is enlarged, there could be the chances of the typhoid fever. So these are some of the common symptoms: fever, head and muscle aches, stomach pain will be there, rashes will be there, and loss of appetite, constipation, diarrhea due to enteritis, exhaustion, tiredness will be there. There are different type of food poisoning. Yes, it is due to the contaminated food and water, like E. coli food poisoning. Yes, if there is a uncooked food, that can be associated with E. coli food poisoning. Yes, there is a one condition is staphylococci or staphylococcal food poisoning. This is associated with the staphylococcal bacteria that can cause the gastroenteritis, that can cause the diarrhea, that can cause the violent vomiting. Yes, but these bacteria are heat resistant. So while cooking, you cannot say that this bacteria is killed off. So this bacteria they can be retained in the high temperatures as well. Now coming to the Clostridium perfringens food poisoning. This is also one of the food poisoning through the Clostridium perfringens. It is ingested in the food. Yes, when we are taking the meat, or at the time of, means they are associated with the meat. Many times we have seen that particular thing, or that particular contamination is associated with the meat in between of the slaughter and when it is reaching to the consumer. Yes. So these are some of the food poisonings here. Now coming to the cholera. So cholera is caused by the Vibrio cholerae. Yes, this is also one of the condition which is a patient is getting from the contaminated water or fecus. Yes, or it can also cause infection in some of the other person when the patient will vomit. Yes. So amoebic dysentery, which I was talking, is invasive disease in nearly 10% of cases, whereas self-limiting asymptomatic infection in 90% of cases, means these patients can be that particular disease is self-limiting. Now coming to some inflammatory bowel disease. So inflammatory bowel disease, there are two very common diseases, is the Crohn disease and ulcerative colitis. This is affecting the intestine. Yes, and the basic risk factor we will see. So age is responsible. There sometimes we have seen some particular races are more prone for this Crohn disease or ulcerative colitis. Immunity, yes, autoimmunity disorders are also associated with it. Then family history is responsible, cigarette smoking, and sometimes we are taking non-steroidal anti-inflammatory drugs that can also cause the inflammation in the intestine. So Crohn's disease and ulcerative colitis, the basic difference here is the Crohn's disease, it is in the last part of the small intestine and the first part of the colon, that particular area is only affected, whereas in the ulcerative colitis, the mucous lining of the large intestine in the rectum. Yes, so this is one of the basic difference in the site, whereas if we will see the Crohn's disease, it is remains confined to the colon. Yes, whereas ulcerative colitis will affect all of the 3 layers of the bowel wall. Yes, and if we will see the symptoms here, the diarrhea will be there, bleeding will be there, cramping pain will be there in the Crohn's disease, fever, fatigue. If you will see the symptoms of the ulcerative colitis, that is causing abdominal pain, loose and bloody stools will be there, incontinence, fat, loss of appetite will be there. So there is a location is different and the part affected is different. Yes, I hope this is clear to all of you about the common disorders associated in the esophagus, mouth or the intestine. The latter part will covered in the part number 2.